Hello
Hi,
and
Doc.
good afternoon. And welcome po sa inyong lahat. I'm Dr. Ana Yark Bondoc, and our program is called Libreng Consulta. We will try our best to answer po the questions that you send us in the time limit that we have. Please remember that the answers po are general in nature. Though sinagot po namin yung tanong na yon, we cannot give you all the details na hindi naman po namin kayo na-examine. So the best still is to consult your doctor. But sana makabigay naman po kami ng konting direksyon kung saan po kayo dapat patungo. Okay, how to join? Marami pong nagtatanong. We are live on YouTube. We are live on FB. Please put your questions below on the poster po. We will try our best to pick up what we can. So please join us po and we are happy to have you. Please like and share din po para mas rami-rami po kaming matulungan. So yesterday, we were not able to finish all the questions. Ang dami nga pong naiwan. So we will try our best today na humabol. Okay? So thank you po. And question number 1.
Okay. Our question number 1 po is,
Oh, ako na lang muna while Miss Kat is typing. Somebody sent this question to me. Doktora, how do I join your libreng consulta? Okay, how to join? Just tune in po pag nag-live kami, like right now, ilagay nyo lang po yung tanong nyo sa baba and we will do our best to pick it up. So sa mga sa cellphone ko pa pinadala, personal cellphone ko. So yes, please join now and then send your question. All right, Miss Kat, are you ready for our first question?
yes po, Doc.
Okay.
From Miss Bernadette Ricafort Sardilia. Doc, pag masakit po ang katawan, lalo na yung balakang, pero di naman po nilalagnat, ano po kaya ang ibig sabihin nun?
Well, usually pag masakit po talaga yung balakang and sometimes that's connected na po rin sa likod, most likely it is due to age. Or baka naman ho, you've been sitting too long, mabigat po yung balakang nyo. But again, kung nagpe-persist po ito, kasi ho, around the balakang, ang dami ring areas, lalo na kung babae, these are the pelvic organs, yung ovaryo, tiyan. Kung talagang grabe po or it's not going away, you need to see your doctor. But kung balakang po, sometimes related to the back pain po talaga is very, very common, especially as we age. Solusyon, lose weight, and if it persists, see the doctor. Thank you so much. Pasensya na, Bernadette.
From Miss Michelle Sunga. Doktora, di po malala sakit gastritis kasi po sinusumpong po ako ng takot. Dakal pong salamat. God bless po.
Ang dami pong binanggit ni Michelle ng mga sakit. Sakit ng tiyan, gastritis, and takot. Natatakot ka ba dahil masakit ang tiyan mo? I hope I am interpreting it well, Michelle. Let's go to gastritis po. Usually, nandito po, sa ilalim lang po ng ating breast area sa gitna. Usually, umaasim. That is usually the pain of gastritis. And napapansin po natin yon when we skip meals and sometimes po when we drink acidic drinks and certain foods. So what should you do? Kung alam niyo pong may gastritis kayo, first of all, investigate your diet. Ano ba iniinom mo? If you have gastritis, please try to avoid citrus. Ano ba citrus? Suha, orange, ganun po, no? Do not eat that. Nakakaasim po ng tiyan. Number 2 na nakakaasim ng tiyan, coffee. Stop drinking coffee. Number 3, soft drinks. Talagang yan. Lalo na kung wala laman ng tiyan nyo, maiirita po yan. And try to eat your meals on time. However, kung nagpe-persist po talaga yung gastritis sa inyo, again, it's time to see your doctor. So don't worry so much. Pwede po yung makontrol if that's really gastritis by what you eat. And if, of course, it's not getting better, time to magpatingin.
Yep. From Mr. Von Vincent Pitt. Good PM. Dok, tanong ko lang po, kung ang sanhi ng pagkakaroon po ng mild hepatomegaly, fatty inflammation grade 1 ay ang pag-inom ko po ng micropills. Pag-inom ko po ng micropills, mataas din po cholesterol ko. Sabi ng doktor ko po, posible dahil sa pills. Kasi hindi naman po ako painom ng alcoholic drink at hindi mahilig sa mga matataba. Pinastop na po ng doktor ko yung pills ko. Need ko po ng second opinion, Doc. Salamat po.
That would be a good idea, ma'am, always to get a second opinion. Kung na-stop na po yung pills nyo, I don't know what you're taking kasi po eh. So kung na-stop na po yung pills nyo, you might try another kind or you may try another form po of birth controls that may include po IUD. IUD does not affect the liver or hepatomegaly or any problem po sa inyong atay. So kung sa tingin po ng doktor nyo, stop the pills po and find another way of having a birth control po. And yes, it is good to have a second opinion.
From Miss Michelle Sunga. Love you po, Doktora.
Thanks, Michelle, and I'm hoping that you get better. Huwag kang nervyusin. May solusyon lahat yan, ano?
From Miss Vax Flores. Doc, ano po ang tamang gamot sa bato sa bato?
Ay, thank you, Miss Reina. Miss Reina is our nurse. Thank you sa humabol. Vax, bato sa bato. I have a video on that by Dr. Dodge Limpoco. Dr. Dodge is one of the most prominent and very good urologists po based dito po sa Pampanga. So, Vax, what is the gamot sa bato? Number one talaga, you really need to hydrate yourself. Talagang ano po, once you are in a dehydrated state, talaga nagkakaroon po ng bato ang mga tao. Kwento nga ni Dr. Dodge, siya mismo nagkaroon ng bato when he was driving from Macabali to Quezon City. Yun talagang inaaraw-araw niya, and of course, he doesn't want to drink kasi nasa highway. So, pati yung doktor nagkaroon ng bato sa bato. So, if you have, what are the signs of bato sa bato? Painful yun, talagang napakasakit, parang nanganganak po ang lalaki, okay? Or if you find blood, talaga in your urine, have yourself checked up, ultrasound, x-ray po, possible CT, but we can start with the ultrasound, bato sa bato, kidney stone, okay? Ang solusyon nun is to see a urologist. They will discuss po with you what form. Pwede pong i-blast po yan with sound waves. Ano po? So, my advice to you, kung alam mo na may bato ka sa bato, see a urologist. Kung wala and you want to avoid bato sa bato, drink a lot of water.
From Mr. Marjo or Kylie. Doktora, ano po kayang magandang gawin or anong magandang exercise kasi po lagi pong may pain yung talampakan ko as in po buong paa. Pero mas pinaka may pain ay yung sakong pag nilalakad nagpa-laboratory na po ako. E normal naman po lahat. Ang result like sugar, uric acid, creatinine, sodium, etc. Nagpa-check up na rin po ako sa lab nang magpa-reliever at vitamin sa nerve. Wala naman po improvement. Almost 3 months ko na din po itong iniinda. Hoping for your reply. Thank you.
Eto lang this happened to me. This happened to my mom. This is a condition that we call plantar fasciitis. Sa ilalim po ng paa, napakasakit talaga. It happened to me. Actually, there is no cure. It comes and goes. Yung sa nanay ko po, she was advised to wear shoes po with heels. Hindi po ito nakikita sa lab testing. My advice po sa inyo is to see, there are exercises for this I would see po an ortho. Okay? Usually po talaga, this is what we call, it's an inflammation of the litid sa ilalim ng inyong paa. Nangyari po sa akin yun. It was just really terrible. Hindi po nakikita sa laboratory. There's no lab test for this, okay? It's a physical exam. Advice ko sa inyo is to go to an ortho. There are also exercises po that can be prescribed for this. Masakit ito. Let me type it lang para you can type it. Wait lang I'll type it for you guys. Patingin nyo po ito and see if this applies to you. The term is called plantar fasciitis. Okay? Wait lang Okay. Plantar fasciitis. Okay. Yan. Patingin nyo po yan sa ortho. You ask them, sabi po ni doktora, I may have plantar fasciitis. Paki-check up nyo po ako. Okay? Masakit ito as in super. It happened to me. It happened to my mom. Nasa US pa ho kami nung nagpatingin po si Mommy Dearest. I cannot yan, plantar fasciitis. There are exercises and some people po are not allowed to wear flat chinelas. They have to wear yung mga 1-inch heels. Patingin nyo po yan.
Okay, next question from Mr. Jimmy Soriaga. Good afternoon, Doktora. Tanong ko lang po, nag-positive po ako sa COVID 2 months na po. Pwede na po ba akong magpa-booster after 6 months ng COVAX ko? Thank you.
Yes, you can have a booster na rin po, especially if you are a senior. The government has already allowed seniors po na 6 months na po ang kanilang pagbabakuna to have a booster shot. But again, ayoko masyadong pasukin ng boosters because I would really like to encourage those people na hindi pa po nabakunahan at even once. So if you're listening at hindi pa po kayo nabakunahan, yung mga tao po, the reason that I encourage people na hindi po mabakunado, I'm just worried we'll have people with 3 shots and people with 0 shots. So, ako po yung 0, gusto ko maging 1 and then gusto ko maging 2. And when we are all 2, then let's talk about boosters. But yes, the government has allowed booster shots already. No, hindi pa po ako na booster. But actually, pwede na rin po. Seniors, frontliners, and yung mga na-transplant po and cancer chemotherapy are now allowed to get booster shots.
Okay, from Miss Melba Paliado. Doc, palagi pong sumasakit kaliwang baywang at sumasakit ng likod ko. Hindi ko maintindihan yung sakit. Ano pong dapat kong gawin?
Ma'am, two possibilities. Kung talaga pong is it back pain on the left side, check your kidneys at saka po yung ihi nyo. That is usually the most common cause of back pain po on one side. Ngayon, kung talagang likod lang ho talaga, well, that could be arthritis and aging. So, hindi ko po kayo ma-examine eh. If it's really on the side, usually I would look at my kidney. If it's really on the back at mukha pong sa buto, and that's really very common po as we age. So, patingin nyo po muna yung urinalysis nyo if you think it's the kidney. If not po, then you might try to lose a few pounds. Kung may doubts po at talagang grumagrabe, then you need to see a doctor.
From Miss Lori Santiago. Doc, ano po bang gamot sa Makati ang both side ng singit?
Ito po ba yung singit po sa paa, no? This is very, very common po. Especially among diabetics kasi because nababasa, napapawis, we sometimes develop po fungal infections na light sa singit po natin. Do not scratch. My best advice po sa inyo is to keep dry, keep dry when you use the bathroom, when you wash yourself, always keep it dry, change your underwear frequently, and if you're diabetic, check your sugar.
From Miss Jason Buenaobra. Magandang gabi po, Doktora. Ano po bang mabisang gamot o panlaban sa asthma? Lagi akong hinahapo. Maraming salamat po.
Are you a diagnosed asthmatic, Jason? And what are you using po for your maintenance? I described this already, no? True asthmatics po, they usually use inhalers. There are 2 kinds po of inhalers. Yung nagbubukas po ng mga baga or the bronchi, yung maliliit po na stem ng ating baga. These are the beta-2 antagonists po. And then, the beta-2 po ang tawag dito, Ventolin, salbutamol, may short-acting, may long-acting. Okay? And the second inhalers po na ginagamit po ng mga hika is inhaled corticosteroids para kumalma po yung inflammation that is causing the problem. So, dalawa po, no? To open the bronchi and number 2, para bumaba po yung inflammation. So, those are really the 2 starting medicines po ng mga taong may hika. But before we even go into medicines with hika, the best thing talaga is to avoid. Alamin mo kung bakit ka hinihika. May aso ka ba? May pusa ba dyan? Is your husband or your parents smoking? Meron bubuhod talagang nagsisiga sa inyo? All of these. Are you allergic to pollen? Meron pong hinihika after exercise, after the aircon, yung cold air. And meron naman pong hinihika after COVID and after viral infection. So the best is really avoid. And after that, treat po with inhalers. Okay?
Hello po, Doktora. Ako po palagi po ako nagkaka-acid reflux po.
That's not good, no? Kasi talagang, that's another form of gastritis po, no? Sinasabi po na I cannot sorry Ang dami pong messages na pumapasok eh. Ang dami pong messages. What is the message of Miss Reina? Let us change cover photo. Mamaya na. Okay, I cannot concentrate together. So,
Sorry,
gastritis.
No, we had,
Pasensya na po.
Sorry, nakat po kasi tayo ni Facebook earlier. We just want to apologize to everyone. Okay na po. Nagbalik na po tayo. On air na po tayo ulit. So,
Ay,
ayun
thank you
po.
so much. Pasensya
Yes,
na po,
opo.
everyone. Sorry, naguguluhan po ako because of the number of messages that are coming in at the same time. So, yes, if you have, yung tinatawag po nating acid reflux, GERD is another word, gastroesophageal reflux disease, Kung parati pong nangyayari yun, you really need to identify po yung diet nyo. Avoid the things that cause gastritis, nabanggit ko na po, no? That's soft drinks, citrus, maaasim po na mga, caffeine, coffee. And then you try to eat po 2 hours before you sleep kasi para makababa po so that you can digest your food. Again, you can also try to use a pillow para naka-elevate po yung ulo nyo. Ang dami po talagang tanong about gastritis. So, pasyensya na po. It's really so common. If it keeps happening, you need to see your doctor po para for a further checkup. Okay?
From Mr. Ricardo Mariano Paras, Congressman Dr. Ana, ako po si Kagawad Rica. Pasensya na po kanina. Umalis po ako at pinatawag po ko ni Kapitan at si Congressman Rimpy. Pero sinabi po sa akin kung ano pong napag-usapan nyo ng mga kagawad sa San Gabriel na kasama ko next time po ulit. Sana makasama ko din po kayo ulit.
Wow, that's so nice. We were in San Gabriel, Macabebe, which is my home barangay. And pinulong ko po lahat ng barangay council, our barangay chief, our barangay captain, Mr. Marlon Aguirre. That's my home barangay. At inalam ko po kung ano po yung mga projects and kailangan po nila for the next 3 years. I'm happy to have the opportunity to represent you po in Congress muli and asahan niyo po yung ating pong pagkakaisa and working together for the next 3 years. So Sir Rick, don't worry. This is only the first time that I visited you and pabalik-balik po ako dyan. Huwag po kayong mag-alala. Okay? Thank you.
From Miss Santos Gina, magandang gabi po. Tanong ko lang po kung ano pong antibiotic pwedeng inumin sa paulit-ulit na pagtubo ng kulitis sa mata. Salamat po.
Ay, Ma'am Gina, I'm not an expert po sa mata, no? We do guest ophthalmologists here. Usually, ang alam ko po talaga, that's topical. What is the meaning of topical? Pinapahid po talaga sa kuliti. So, I would consult po an opta kasi that's really not my specialty at ayoko pong mambola lang po ng tao. Okay? So, let's wait pag may opta and tanungin po natin.
From Miss Jasmine Mangalindan, Doc, Tagalubaw po ang mister ko, pero ngayon kami ay nasa Laguna. Ang second child ko po na 21 years old, may hika po siya. Pero mula noon na nag-gym siya, medyo hindi na siya sinusumpong. Kaya lang mula pandemic, parang lagi na lang may ubo siya. Yun po, paubo-ubo lang, di naman tuloy-tuloy. Ano pong magandang vitamin sa kanya? Palagay niyo po nakakasama ba ang vitamin sa kanya? Inom niya po is potency po, 500 mg. Salamat po.
Okay, ma'am, first of all, okay, let's put it this way. 21 years old, diagnosed na asthmatic. Ngayon po, paubo-ubo. Mas mabang vitamins. There's nothing wrong po with vitamins. Vitamins is not related to asthma. At least wala pa po ako naririnig, no? So it's okay to take potency. Ang worry ko lang po talaga, no? Naka-inhaler na ho ba yung anak nyo? Maybe your anak should start inhalers po, no? And ito lang ang sasabihin ko ngayong panahon ng COVID ha. Nung unang panahon po, people with light asthma, yung inuubo-ubo, ganun, di nila pinapansin. Kasi natitiis pa rin nila. Kaya lang panahon po ng COVID ngayon, if you work in a factory or kahit may nakatabi lang ho kayo sa jeep, biglang umubo-ubo kayo because you have light asthma, wala ho talagang tatabi sa inyo and you can no longer go to work. Kasi the first question po is, are you coughing? If you check that, home agad kayo. So, ang advice ko po sa inyo, ma'am, control the asthma po ng inyong anak. Start inhalers kung hindi pa po. Kung naka-inhalers na po kayo, then have a talk po with your pulmo kung paano po natin talaga matatanggal po yung ubo. Kasi habang may ubo po, lalo ngayon ng panahon ng COVID, marami pong nininervyos. Even though you tell me, hindi, asthmatic talaga ako, inuubo talaga ako, huwag kayong magpanik. Magpapanik sila. So my best advice, see a doctor po, start the inhalers for asthma kung hindi pa po, and then avoid po yung mga situations po na hinihika po kayo. Okay?
From Miss Lorna Parungaw, good evening po, Doktora. Ask ko lang po kung ano pong pwede kong gawin sa mga pantal ko na lumitaw sa ilalim ng aking kilikili at pati na rin sa aking dede. Lumitaw po ito 3 days after ko ma-vaccine. Sobrang kati at kumikirot po. Salamat po.
Ma'am, you need to go back. I'm sorry to hear this. You need to go back po dun sa kung saan po kayo nagpabakuna and pa-assess nyo po if it is related or if it's an allergic reaction. Okay, kung puntahan nyo po yon immediately. Kailan po ito nangyari and when were you vaccinated and what were you vaccinated with? It's possible po that it's not related eh. Kasi usually po ang ang allergy po talaga yung mamamantal. It's not really hindi siya ano ba sinabi ni Ma'am, butlig-butlig? What did she say?
Meron daw pong mapulang pantal-pantal po.
Pantal-pantal. Okay. Usually namamantal but it will be whole body, hindi po talaga sa isang area. Pag namantal po due to an allergy, because the COVID vaccine went to your whole body, buo talagang mangyayari, usually sa back, ganon. And it usually happens po within the next first 12 to 24 hours. My best advice, balikan nyo po kung saan kayo nagpabakuna at pa-check up pa po kayo uli. And again, if you suffer a reaction po to a vaccine, meron pong form by the FDA and you can fill that out po on the internet. So go back po kung saan po kayo nabakunahan.
From Miss Marites Briones, good evening po, Doktora. Ano po yung magandang gamot pag nahihilo? Thank you po, Doktora. God bless.
Ma'am Marites, my question to you, how do you describe your hilo? Kasi kung talaga pong umiikot po ang kwarto, that's why I cannot understand Filipinos when they say hilo eh. Kasi merong nahihilo because mababa yung blood sugar. Merong nahihilo dahil mataas po yung yung kanilang BP. So, meron pong the truly hilo, yung umiikot po yung kwarto. So, lahat po yan has a different approach. Okay? So, I cannot understand po kung saan po tayo. I'm just gonna go into the hilo na umiikot po ang kwarto. Kung umiikot po yung kwarto, yung talagang you have to hold on kasi parang feeling nyo babagsak kayo and the room is spinning, you need to see po a neurologist. That the usual cause of this is may infection po sa tenga, maybe you had if you had a cold, they might give you po decongestants. Kung wala naman po talaga kayong cold and the problem is in your ears, then you might have what we call Meniere's disease. So, kung talaga pong umiikot yung kwarto, I would advise a neurologic consult, lalo na po kung hindi po kayo nagkaroon ng any ear infection or any cold. Okay?
From Miss Sephora Moises, totoo po ba, Doktora, if may pneumonia po at may paubo-ubo, hindi pwedeng magpa-vaccine? May asthma din po ako.
Nako, talagang hindi po talaga pwede. That's another issue. Thank you for bringing that up. Kasi when you go to the vaccine center, they will ask you, may nararamdaman po ba kayo? Like, inuubo, mataas ang temperature. Kasi baka hindi pulmonya yun, baka COVID yun at mahawa lahat ng tao sa vaccine center. So you need to be healthy po before you can go to the vaccine center for your own safety and for the safety po of the other people there. Marami na pong pumila, no, inuubo. Tapos, tinest, positive. So may COVID, pumipila sila. So yes, if you are coughing, if you have pneumonia, if you have a temperature, if you have lagnat, hindi po kayo babakunahan. Baka ma-isolate pa po kayo. Kasi safety nyo rin po yun, because you might have COVID. And number 2 po, baka somebody po might get sick po in the vaccine center. So pa-check up po kayo if you are feeling that. Don't go to the vaccine center, check up po ang tawag doon.
From Miss Charlie Vinuya, Mr. Charlie Vinuya, Doktora, ano pong magandang gamot sa TB?
Hindi po yung magandang gamot eh. There are prescribed gamots. Thank you for this question, Charlie. You cannot choose yung gusto nyong gamot sa TB, hindi po. The gamutan po sa TB is based on the sensitivity po ng dinura nyo. What is the meaning of sensitivity? Ang meaning po nun, dudura po kayo. Palalakihin po yun sa laboratorio. Then they will see which of the TB drugs are effective po, no? Pinapatay po nila yung TB lumaki po galing sa baga nyo. So it's not maganda, pero kung ano po yung nararapat. Okay? Ang maganda, wag po tayo magka-TB. That's the number one. TB is highly infectious and actually po, there is a cure but it will take at least 6 months. And kung talagang you got the bad form, yung multiple resistant, baka 9 months to 1 year pa po. Hindi po biro ang TB. We just don't give it the proper attention, but TB is a very serious problem po rito sa Pilipinas. So we're coming to 30 minutes. Our last question.
Okay, for our last question from Miss Josefina Aguilar. Doktora, naoperahan po ako sa gallbladder noong 2020 February. Bakit po may time na medyo sumasakit po yung opera ko minsan?
Well, Mom, you know what? Sometimes we think that we are well. First of all, I want to ask, how were you operated on, no? Kasi po, yung traditional gallbladder, they have to cut po the layers of the skin. Ngayon po, kung yung the newer one, the laparoscopic, they just put po mga butas sa tiyan. Regardless po, of what operation you underwent. Binuka pa rin ho yung yung tiyan nyo, especially kung open gallbladder, yun po, how many layers of skin ang pinutol. So, sometimes you are already okay, you think you're okay, pero malaki po yung putol niyan sa loob. So, you are still healing. And in fact, it takes up to 1 to 2 years po to be completely healed from a major operation. And there is scar formation rin po doon as you are healing. And sometimes the nerves are sometimes, sensitive. Yung tatay ko po had a major liver operation. Kuminsan po talaga daw biglang may kikirot 5 years after. So give it time. If you are healthy naman po, you can eat well, you've been checked up with your doctor, wala na pong dapat ikabahala. Pero kung talaga pong grabe, may nana, namumula, you're worried, wala naman pong masamang magpatingin uli to your surgeon. But for those who got even CS hindi biro yun po yung cesarean. People think that, hindi pa CS na lang ako. Any operation, especially po pag binuka, there is a healing going on up to 1 to 2 years po after your OR. And it's possible po na kumirot yon from time to time. But again, if you are worried, check up po. Okay? I would like to make a patalastas po, no? We are forthcoming po. December 1 is the big back to school, VACC, no? Bakuna po ng mga bata dito po sa Pampanga, ages 12 to 17 years old. So, para makapag-back to school na po tayo at bumabawas na po ang problema natin sa pandemya, let's have your kids vaccinated. In the province of Pampanga, December 1, talagang uulanin, talagang babahayin tayo ng bakuna. There will be more than enough for everybody. So, please bring your kids age 12 to 17 po, December 1. This is in cooperation po with the Department of Education and ating pong provincial government by Governor Dennis Pineda. Thank you so much, Governor Delta, for this back to school bakuna po ito. 12 to 17 years old. Bring the kids December 1. I will be there. Iikutin ko po lahat ng vac sites po ng atin pong 4th District of Pampanga. And hopefully, it will be a fun, yet good experience for the children para matapos na po yung problema natin dito sa pandemya. So sa inyo po lahat, back to school, December 1 with the province of Pampanga and the Department of Education. I am Dr. Ana York Bondoc and thanks so much for joining us. Pasensya na po, we cannot answer all questions, but I hope that you learned something. Okay, thank you so much. Good evening.